The Nigeria Center for Disease Control (NCDC) has urged the 36 states of the Federation and the Federal Capital Territory to intensify sample collection and contact tracing efforts for the coronavirus. Mrs. Elsie Ilori, Head of Department, Surveillance and Epidemiology Department (NCDC), made the appeal in Abuja at the 62nd Joint Presidential Task Force briefing on COVID-19. She stated that a few years ago, the agency began the gradual rollout of a digital surveillance tool called SOMAS in Nigeria. The head of surveillance said that since the beginning of the response, NCDC has rapidly scaled up the deployment of SOMAS across the country, adding that it was being used in facilities and laboratories nationwide. She said that the health agency had supported states to engage SOMAS data clerks as well as volunteers to aid surveillance activities in local government areas.
However, in a country of over 200 million people across 774 local governments, this resource intensive is very rigorous. In many ways, we have intensified our surveillance activities to not only understanding the epidemiology of COVID within our context, but to help us to respond accordingly. This also feeds into our guideline, which we have produced, and advisories which we have developed and sent to states. This SOMAS allows real-time case-based surveillance from health facilities to the local government, to the state, and then to NCDC. And we have actually leveraged on previous disease outbreaks like Lassa fever in the country and now COVID. Each time a new case is recorded from any part of the country on SOMAS, we immediately view it at our emergency operations center on the dashboard. So using SOMAS at a glance, we can view the number of cases and specific indicators for each case, their symptoms, the current status. It's a whole package that gives information on how a case is managed up to the laboratory samples that are collected, and this allows us to be able to harmonize our outbreak response. And so this SOMAS, in addition, allows us to do contact tracing. That also helps us, which is one of the core surveillance activities we have employed in this response. And this entails follow-up of people that have been in contact with a confirmed case of COVID to ensure that they do not infect others. We monitor them regularly for 14 days to ensure that they do not develop symptoms and then not infect others. For this response, NCDC has trained state teams in improving surveillance, including the case definition and investigation and reporting.
In addition, she said that NCDC had continued to develop and update existing guidelines as knowledge on the disease evolves. She explained that recently, the agency published and shared with states strategies to improve surveillance for COVID-19. This, she said, was accessible via the agency's website, covid19.ncdc.gov.ng.
Of course, we are grateful for the support of the Africa CDC, for the engagement of 200 community health workers. That's to enhance our contact tracing activities. This is a guiding document that helps state teams to be more strategic in the implementation of the activities to improve the overall response to COVID. To date, preventive measures have been recommended have been informed by the epidemiological data on COVID in Nigeria, as well as observable trends across the country. We continue to urge Nigerians to support states and the national effort to curb this disease, and this includes adhering to preventive measures, such as the use of the face mask, and getting tested if you are showing any signs of COVID, and spreading information only from official channels.